As you're waking up this morning, you might not be in any pain. Wouldn't that be great? But that doesn't mean degenerative disc disease isn't happening to you. Father Time is always rolling, and that at a certain age, your back might start to feel that pain. Dr. Miller from Total Health Chiropractic is here with more to tell us how some people may be suffering from degenerative disc disease and not even know it.
That's right, Todd. A lot of people don't understand, but if we don't take care of our spines through our lifetime, they do tend to rot and decay, and that's what these models show here. And part of that is degenerative disc disease, and what's actually happening with these patients is these pads and spacers, which are discs, start to dry out, and it's like a sponge that dries out where they start thinning down in height and shrinking, and then these bones start encroaching on the nerves and cause horrible neck or back pain. But as it begins, it's many times like a cavity in our tooth where we may not necessarily feel it, but it affects our health, and if that's not corrected, it can lead to big problems down the road.
And as I mentioned, people could be watching this thinking, my back feels fine. Is there a certain age where you kind of see this really start to ramp up?
Well, that's a kind of a misconception a lot of people have, is this is due to old age, and it's not. This is all due to stress in our lives and neglect of the health of our spine. So, obviously we can see this in people that are seniors, but we're also seeing it, if people are really stressed out or have injuries, we could even see it in early 20s. But a lot of times as it's beginning, they don't feel it. They may have some episodes of pain and it goes away as their body adapts. But as it gets worse and worse, it can actually lead to other conditions like a bulging or herniated disc, and then that can cause more than just neck or back pain. That many times will affect the arm or the leg, like sciatic pain. And we're talking about pain, but this is more than that. It affects function of these patients, where a lot of them just have to constantly find a place to sit because they can't be on their feet very long. It's very painful getting up out of a chair, tough getting going each morning. It might take them half hour to a couple hours just to get moving each day. And the worst cases, as it affects the legs, there's concern of falling down as the leg might give out, or if it's in the arm, they may not be able to write correctly or hold things because they develop weakness in these extremities.
Yeah, many people may not realize that it affects your extremities. It may be back pain, but your arm, your leg, these are the things that are affected when those nerves get pinched. Let's talk about how we can solve it. And obviously we have Dwight, who's going to give us a great referral and really a testimonial as to what you've done for him. But I'm assuming Dwight here was part of your DRX 9000.
He was, Todd, and a lot of common recommendations when people struggle with this is what you hear in the medical route is take more drugs, do physical therapy to work on the surrounding structures and maybe support the spine a little better. Worst case scenarios, they start doing shots at pain clinics or even neck or back surgery. And usually these treatments are just a treatment to mask the pain and help them ease that pain, but they're not actually fixing the cause and getting their spines healthier. And that's why it's frustrating for people. They have to keep doing those treatments over and over again, constantly trying to mask the pain. Our solutions in our office are non-invasive, they're non-surgical, and we're working on fixing the cause of their pain. And with spinal decompression, this is a medical device that actually helps to take people in this state and reverse that, getting their discs and their spine healthier so they can go live a normal life once again, because we're actually able to retract those herniations and bulges in off the nerves and start regenerating these discs. So patients are getting great results because we're fixing it, not just masking the pain.
I like that, regeneration instead of degeneration, which is what we're looking for. And Dwight, that's something that you went through. So let's get a little bit about your story.
2.5 years ago, I had an issue where one day I got up and both legs went numb. And I called my previous doctor that time, and he goes, well, you better go get an x-ray. So I did. X-ray didn't show anything, so I went and got an MRI. And I got sent to the pain clinic. At that time, it was like, that's the only choice I have. So I went to the pain clinic. Doctor goes, yep, you got bulge 3, L3, and L4, and 5 a little bit too. I'm like, okay, what's the deal? He goes, well, we can give you injection in L3 and L4 and it'll help things out. So at that point, I was really hurt. So I contemplated for about 3-4 days. I told my wife, I said, well, let's go do it. Well, Memorial Day weekend, 2 years and 6 months, just like you flipped the switch, it went away. And when I went away, I was right back to where I was, except this time my left leg didn't work. I'd walk, it'd lock up on me. Right leg was doing the same thing, getting everything back I had. So I went ahead and called, got a hold of Dr. Miller, and I set up the appointment. I took my MRIs in, and I said, well, what's my options? Can you help me? He goes, yeah, I think I can help you. I go, I really don't want back surgery. And he goes, well, there's choice back surgery, there's acupuncture, or you can use a DRX. I go, okay. He laid the plan out, and he goes, it's up to you to decide. So I looked at my wife, Cindy, and she goes, you know, what do you got to lose? I go, not much. I said, Diane, you know, at that time I got the pain.
You could lose the pain.
I
right?
lose the pain, and I said, okay, let's do it. And as we got going through that, things started going the other way.
Really started to feel the results.
Pain started going away, started feeling better. And then
how about today?
Great. I don't have any pain.
Today's pain, no pain.
No pain.
So when it comes to getting a shot in the back or laying on a DRX 9000,
DRX 9000, because I'm on the tail end of the session. This is my last week. We went from the DRX into a spinal force. That, to me, is a great machine because that really moves your back, your muscles, it gets you to balance yourself out. And yeah, since I've been on that, it's a whole different story. And the way I found out I was doing good when I got up in the morning, if I stood on my right foot, it was like, holy smokes, this ain't right. And then one morning I got up, it was like, wow, no pain.
Appreciate your time. Thank you so much for the testimonial. If you want to get that same result, maybe you're starting to feel that strange tingle in your foot or maybe your arm, and as Dr. Miller mentioned, and maybe you're having trouble holding things, there is a special $50 off your first visit if you schedule today. First 3 callers get a free MRI review as well. Now, all you have to do is call the number on your screen right there and be one of those people. Now, if it's busy, keep calling. They'll try to get you in as soon as they possibly can. It all happens at Total Health Chiropractic. Again, Dr. Miller, thank you so much for the time this morning.